So we're going to spend the next 50 minutes going through just a little bit of update from each of the subcommittees. So I don't know the order. Of course, I don't have my glasses. Catherine, I don't know what order we have the subcommittee slides in. Is that the order? I don't have my glasses, so. Okay. So please pick a representative from your group. We're going to give you 10 minutes. 9 minutes, I give you like the look of death, so that you can come down.
I'm so fast. You know how fast I talk. I'm not from the Bronx, but I talk fast.
Okay. Do you want me to do this part and then you do the
Yeah,
next
yeah,
one?
yeah. It's ordered in that way. Is
Okay,
that
great.
okay?
Yeah, that's perfect.
Thank you.
All right, as everyone's settling in, I'm Lauren Amos. I'm a pediatric hematologist at Children's Mercy, co-chair of the Research and Publication Subcommittee. So we'll go through kind of where our current projects are, and then we'll talk a little bit about things that we talked about in our meeting. So the first project that we have is the Equipped study. That's Dr. Megan Brown's study. She is unfortunately couldn't be here today, but I do have an update that she has 10 sites activated now, 150 subjects enrolled. This is a prospective observational study looking at treatment for heavy menstrual bleeding. And it's currently paused for enrollment for a no-cost extension, but that should be ironed out and they'll get going again. There'll be a little bit of transition in roles because Dr. Brown is going to Penn State, and so Dr. Sidonio in Atlanta will take over as acting PI for that. But this study aligns with our goals because it's building evidence about treatment for our patients, and we look forward to more information to come. The next thing to talk about is very exciting. So the Building Clinics model paper has been something, if you've been in the research and publication subcommittee world, that's been on the list to do for a very long time. So I'm very excited to say that as spearheaded by Dr. Ming Lim, that the description of the WGBD Clinic of Excellence model and examples of implementation in various settings in the U.S. was submitted to RPTH and accepted as a research letter just last month. And so there should be copies available, and this is a huge thing to check off the list. So definitely take a look at that paper, look for it online. It's really exciting that we've got that out there. Next up is my combat study, and this was a retrospective multi-center study looking at efficacy and safety of antifibrinolytics and hormonal therapy. That's probably shouldn't say recent, but I did present at ASH last year as an oral presentation, and the manuscript is in progress, and I told the publication committee that the next time we were together in an FWGBD setting, not ASH, but after that, that'll be done. I'm putting my timetable on there. And then we'll move forward with a prospective study to further look at antifibrinolytic therapy and hormones, and that will be a pediatric and adult combined study, so we'll be looking for LAN participation in that as that moves forward. I'm talking really fast because Jen scares me, so I'm going to let Peter go now.
Is there a way to advance the slides on this?
I think, yeah.
Just green? Oh, wait.
You went too far.
I went too far.
Go back, yeah.
Go back.
Yeah.
Ah. One time. No. What's happening?
9 minutes.
Oh my God. Okay. Sorry. We had an update from Dr. Ruchika Sharma regarding her proposal submission, and she's hoping to resubmit. Her interest is in identifying coagulation factors through molecular testing that may help understand bleeding disorder of unknown cause and heavy menstrual bleeding relationships. A big push that we have for our subcommittee this year is to begin development of a research infrastructure that would work in parallel with the clinical work that we do through this organization. And so more to come with that, but we're hopeful that in the coming months to next year or so, we'll have some more information as to how that's developing. But our goal is really to create a research infrastructure that's similar to Venus Network, if you're familiar with that as a hematologist studying thrombosis, that this would be something that would serve our population's needs and try to answer some core questions for our patients so that we can improve the care for our patients. Okay. In the spirit of collaborative research, I was asked by Dr. Jill Johnson to share with you the von Willebrand in pregnancy study. Some of us are investigators on this study. Dr. Johnson's the primary investigator on this study. She wanted to let the group know that there is funding for 3 more sites. So if you are somebody that takes care of a person who is pregnant with von Willebrand disease, or have patient populations that this would serve, that you're encouraged to reach out to her directly to see about study site feasibility. This is a study that's very important for improving the standard of care for patients with von Willebrand disease who are pregnant. And so I would encourage you to seek this out if this is of interest to you. And the other study that Dr. Johnson and Dr. Shannon Meeks of the Children's Hospital of Georgia, Atlanta, CHOA, and Emory, is the hemophilia research program. And it's really important that we talk about this here because specifically for women and families with hemophilia, they may not be patients at hemophilia treatment centers, but they may be coming to your clinics. And so it's super important you be aware of this decentralized study that's trying to understand bleeding risk in pregnancy and inhibitor formation in childhood by looking at the mother-baby pair. And so in the time that I have left, unless someone yields time to me, I wanted to point out that this is a decentralized study. What's that? No more time. No more time. Got it. So this decentralized study is hoping to enroll patients, and I'll just skip to the end that this study is looking for local partners. You do not need to have research infrastructure because this is not research where you are, because it's decentralized. But this, through vendor agreements, may be able to enroll patients for their study. And so this is the ask. If you have somebody who might be a mom of somebody who might have severe hemophilia A, to please consider reaching out and seeing if there's eligibility at your site. This tool that's on this website, harpf8.org, will tell you if the patient's eligible or not, and there's opportunities to participate, and it's really important that they hit a milestone of trying to get 12 patients on by next year. So we really encourage, if you have a touchstone, somebody who might be a mom of a patient with severe hemophilia A, to please, please, please consider sending patients their way. And that's all I have.
Do we have any time left, or are we done?
See, I told you.
Oh, we don't need to talk more, though.
Okay.
We're good. Yeah.
We're good.
We're good.
We're good. Thank you.
I guess the Education and Advocacy Subcommittee.
Well, we don't have 10 slides like the previous subcommittee. We just have 2. All right. So, our slide is short because what we have achieved was laborious. It took us a long time to set up the cultural sensitivity workshop. And today it was completed, at least phase 1, and I hope it was successful. Comments and feedback are welcome, but the next phase is going to be, how to put all of the information that we gathered today in a manner that it is useful for clinicians to use in a clinical space. So that is what we actually discussed about in our meeting right now. With the education subcommittee, the first thing that we were able to achieve is get more members to join, because we definitely need more hands to help us. It is such a complex topic, and the ideas were many. One of the ideas that we had mentioned during the presentation was to create a book with the drawings, with the writing. So we are going to invite the members to encourage your patients to write something, as well as to put down their thoughts in forms of drawings. And then we will compile it together in a book. But the book will also have information about cultural beliefs, norms, and rituals, so that it can be useful for all providers as just an aid to increase their awareness. The other idea that was floated around during the workshop and we thought we could do next was tools in the form of an intake form and then do a webinar. So all of this is coming out of the cultural sensitivity workshop that we talked about today. I'll let Amanda talk about the HEMONC survey that we are doing.
So the hematology curriculum project is modeled after a similar gynecology curriculum project that was done and published earlier. So the first phase of this is a needs assessment, which is essentially a survey of hematology fellows about knowledge about heavy menstrual bleeding and adjacent issues related to gynecology. And that survey, I think, is being disseminated now, currently. So as soon as we get the results from that, then the next step would be to use those responses to formulate a curriculum for hematologists. And then the last thing, I'll let you talk about the podcast.
So the podcast, we actually finished off with the contribution of the Education and Advocacy Subcommittee in May of this year, when we released the 11th podcast, which I would highly encourage you all to listen. Menstrual bleeding is not a stigma, where our guest speaker was Angela, and she did a phenomenal job. And it covers the cultural taboos and beliefs that are associated with menses very well. And since then, the Sickle Cell Disease Committee has done 2 podcasts which are worth a listen, and the Thrombosis Subcommittee with Bethany is going to take over for the next steps. And just to share some statistics, which is always encouraging to see here, but it is still not at the point where I would want it to be. 2,000 downloads doesn't seem to be much in a 2-year period. So I am requesting you all to, disseminate this podcast because it has such good information, because experts were invited, they shared their knowledge, their research studies, and it covers a gamut of topics, as you can see here. The one that has been listened to the most is the one on normal versus heavy menstrual bleeding. And then we have demystifying the IUDs, which is very important. And my patients love that podcast. They have come back changing their minds about IUD insertions. And then, of course, gene therapy and its implications on fertility. So that is all we have. And I think we took less than 5 minutes. Thank you.
All right. Hello, everyone. I'm stepping in for Suchitra and Yemi because they couldn't be here today. So I'm going to try to summarize what we've done as a group, as a part of the Clinical Care Subcommittee. As you can see, the period pocket guide was created to actually help gynecologists and hematologists in terms of workup and treatment. As far as I know, this has been very well received, and people really use it because it really helps understand what the initial workup at least should be for most providers to help guide or unify how we practice both hematology as well as gynecology in terms of working up a patient for a bleeding disorder. The iron table also has been very well received. I have disseminated it amongst all the providers that I know, and this really, I think, is a very useful resource, and it is on the website right now. So for people who haven't looked at it yet, this is a great resource. Please go ahead and do that. There is also a TXA for the patient document that is there. We had one recommendation for the FWGBD team. It seems like it's a little difficult to find stuff on the website. So if we could find an easier way to guide people to these resources, that might be something that would be beneficial. So having said that, what's next? I think those were the 3 projects that have been completed so far. No, there's one more. The ultra-rare bleeding disorder guidelines, we've actually put together the Factor 7 guidelines for pregnancy and delivery that has been submitted to the board for review for final approval. We're waiting for that. The Factor 11 is currently almost ready to be sent to the board. And the next one that we're planning to work on is the Factor 13 deficiency. And so hopefully these will also be resources that will help unify how people do things and recommendations for delivery and pregnancy. So those are, I think, the big achievements so far of this clinical care subcommittee. Now what the group has been working on is the dot phrase library. So this one has been under the leadership of Dr. Erin Cook and Laura Guzba, the nurse practitioner from Henry Ford. And they had requested members of the subcommittee to submit what currently people are using as dot phrases for their EMR. The intent is actually for us to provide a resource to providers who go to the FWGBD website. And the selfish goal is to ensure that all providers get a complete history. And so by having a dot phrase, hopefully there will be fill in the blanks that people then will actually fill out. So then everybody will have a complete history, a complete BAT, a complete GYN history. And so if we were to ever go back and look at the data, or we planned a project, we would all have collected history the same way, which I think is a challenge. Sometimes anybody who's done research knows this, that somebody asked this question and somebody else didn't, and then that makes that question not askable anymore because we don't have complete data. And so selfishly, we're hoping that by doing this and providing it as a resource on the website, we can then ensure that when we go back and look at our patients, then we all have the history that is completed. So Dr. Cook actually has put together all the EPIC dot phrases for menstrual history, the BAT, the Byton, and the family history. Great job. And now the ask is for the group to email a GYN history. So for the GYN people here, OB and GYN actually. So if somebody could tell us what it is that you want in OB/GYN history, she can make sure that that is incorporated. The other thing that we're going to work on is for people who don't use EPIC, like me, unfortunately. We would like to have this resource available for us too. And so maybe either me or somebody else, whoever is willing, can work on it so that we can have a similar history or a dot phrase that's created for people who are not using EPIC. So that's that. Dr. Cook has also created a tear sheet for heavy menstrual bleeding treatment options now, which the subcommittee will be discussing at the next subcommittee meeting. So we had a very fruitful discussion today. She showed us a draft of all the histories that she's put together. I thought it was fantastic. We had a few recommendations, and I think we should hopefully be able to, she should be able to iron it out and have it ready for everybody to use very soon. And if anybody has any suggestions for that, we're open to that. I know there were 2 potential projects. I don't know if Suchitra was the one who put this together. We didn't get a chance to even get to this because we were still stuck on the dot phrase project. But these are projects that we hope to get to soon. Any questions that anybody has? All right, I'm done.
Hi, I'm Nancy Sakari, and I'm a co-chair with Bethany Samuelson for the LAN thrombosis. I'm also very proudly, I like to think of myself as Bethany's administrative assistant, because as you'll see, she really is the research brains of this committee. These are our projects. We have a case series of SLIND and VTE from 3 different institutions that we are very nearing the final stages to submit the manuscript. The RTB and anticoagulation toolkit is completed, And you can see the goal and alignment on the far side. And then venous thromboembolism in obese hormonal contraception users, a large national database study we just found out was published in RPTH this last week, so congratulations. Divya, a lot of you guys know Divya, she's not able to be here today, but she worked really, really hard on that project with the rest of the team. Uterine bleeding in patients on anticoagulation is a survey study by spearheaded by a couple of hematologists that are not here today, but the survey has closed and they're working on the data, and I believe that it was submitted to ASH, right? At the last meeting, that's what they,
Oh,
was their goal.
Yes,
Yeah.
very last minute, yes.
Yeah. And then we have an interest in heavy menstrual bleeding and the use of IV estrogen in the acute phase. So we published like a op-ed with Amanda French, who's here, and now are working on a survey study. The survey has also closed, and we now are going to be reviewing that data. The 721 podcast collaboration, Bethany is taking over some episodes of that and has solidified, I think, all of the interviewers and moderators, right? For interviews.
Yep, we're just waiting to record.
And then we also collaborated with the sickle cell disease group and created a toolkit. And that was a really fun and awesome collaboration. I look forward to working with that team more. And we just recently did a webinar for FWGBD about a week and a half ago. And then finally, we have a manuscript on the review of PCOS and thrombosis, and we're working on the revisions, hope to resubmit that next week. I think that's it.
Yeah, we're fast.
Oh.
Hello, everybody. My name is Michelle Dole. I'm nurse practitioner at St. Christopher's Hospital for Children in Philadelphia. I'm on the nursing subcommittee along with Charity Stadler, my co-chair. All right, so our slide is only one slide. So we should be short and sweet. The last project that we have done was another tear-off cheat sheet type thing related to common labs. So we recognize that there's a lot of new nurses coming into clinics. There's also a lot of clinics have float nurses that may not necessarily understand the purpose of the labs that we're doing, whether they're hematology related or gynecological related, adolescent related. So we came up with a list of all the labs that we do and the reasoning behind why we're doing it so that the nurses understand why we're doing those labs. So the project was completed. It's in review, so we're waiting for approval, and then it should be on the FWGBD website along with others that we have completed. And then the last thing, so we have decided to revamp the nursing subcommittee a little bit. So originally, when the subcommittees in FWGBD started, there was not a nursing subcommittee, and that was an ask. So it was developed, and over the last couple of years, we've had some challenges with it. So a lot of the things are in other subcommittees. So to enable nursing influence in all facets of the LAN, we decided that we're going to have the nurses join any of the other subcommittees to provide support there. They can just submit where they would like to participate to either Elizabeth or Carrie or any of those, and then they'll be notified of when those meetings are taking place to join that group. The nursing subcommittee is still going to have their quarterly meetings to discuss mentorship things, updates, resources, educational requests, things like that, because there's going to be a nursing track for the biannual conference. And then if any of the other subcommittees want to filter something down for us for a project, then we can take that on and talk about that in the quarterly meetings. And that's all we got.